Hello everyone, turning to our customer spotlight, I'm pleased to introduce Tom Boyle from Sheffield Teaching Hospitals. Hello Tom, just wondering if you can give us a quick intro into you, your everyday role and a little bit about Sheffield Teaching Hospitals please.
Yeah, so as you say, Sam, Tom Boyle, Sheffield Teaching Hospitals, head of Telecoms. I think as an organisation, the easiest place to start with, I think we've got in excess of 20,000 people now, but that's growing like day by day, because not only have we got all the substantive staff, we've got all the staff that are linked to the universities. We've got 2 universities in the city, students that are linked to it. So that number's probably closer to 30,000. I'll get absolutely caned from our comms department for getting the numbers right, but I think we do we do millions of outpatient appointments, inpatient procedures, you name it. We do all of the adult care in the city. And for the region as well, there's elements of that. So there's 5 adult hospitals that we look after. The children's hospital is a separate entity to us, but obviously we do a lot of work combined there. I think specifically to the things I look after, so Telecoms, it sounds like it's one simple thing, but it's quite a broad remit in all honesty, is that there is telecoms and engineering services. So we've got about between 50 and 18,000 telephone numbers, so DDI and then extensions on desks. And that's looked after by a team of 5 engineers that we've got. And then you know Alicia already, but she looks after that from a service management perspective. I also look after the switchboard service, so the main sort of entry point to the hospital. And I think we've got 25 whole-time equivalent staff there. It's 24/7 service. I also look after all the contact centre elements from a technology perspective, so we look after that with our COOS office. And there's all sorts of different sort of peripheral services, side services like outpatient reminders, so SMS services, pagers as well. People might not be fully aware that
they're still going on.
I think we've got within the region of 6,000-7,000 local area pagers, but we still have, I think, maybe 100 wide area pagers as well. It's funny for me to say it, but I'd imagine if anyone's listening, they won't have a clue what a pager is, or a wide or a local area pager. And yeah, there's all sorts of other bits and pieces that flow off of that. So I suppose it's as much as it's looking after a set of technologies, there's also an operational and strategic element to it as well.
We were talking before the filming about just how vast the user types are that you have to support. Obviously, they're in your internal customer. You're on the IT side of things, providing services, and it is quite amazing how many different user cases you have, user profiles that you have. With, you were saying it literally is vast, isn't it?
I think I say to a lot of people, if you consider most jobs, most industries that are out there in the UK, certainly there's probably a role for it in the NHS. So we have electricians, cleaners, plumbers, lift technicians, all the way obviously through to the obvious of a doctor, a radiologist, you name it. Yeah, it's internal linen service. It's you'd never imagine that all these roles exist, but yeah, most roles in most industries we tend to have internally resourced. So there is a different use case over and over again. There's a vast difference in the different things that we offer. It's not just patient care.
And how do you manage that complexity? You've already mentioned some of the people who work in the team, but how do you actually overall, from your position of the management overseeing everything, how do you ensure that the team manage that effectively?
I mean, my background, and so it's probably not the case for a lot of people that do a similar role to me, is their background probably is in engineering.
Yeah.
My background's not in engineering. I think that my background originally was analytics, then I moved into working in program and project management and those sort of things, and then service management was like the one thing I'd not done. That's how I probably manage it, is that I've been at the organisation for pushing 15 years, I think, and understanding how the organisation works and how those different areas and different departments function helps manage how things work. And also I know that I've got a lot of staff, and I've got staff that are experts in what they do. I'm no engineer, I'm no engineering expert, but I do understand how it operates as a business. I understand the needs of the different business areas. I think that everything else flows from there, really.
And just when you identify something that's where you think, okay, due for a change, or because of the various different forces that we talked about in a previous episode, that you need to bring in, whether it's regulation, etc. How do you affect that change within Sheffield Teaching Hospitals itself from a technology perspective? How do you bring people on, and how do you then deliver those innovations into
I think that
the organisation?
Someone will watch this or listen to it, and they'll tell me the exact quote or exactly where it came from. But these days, most organisations are technology businesses. And most people that work there, even though they won't say they're a technologist, is that they are in the day-to-day life. So it's actually quite easy to bring along a consultant or a radiographer on a journey for that, because the tools that sort of I arm them with, or the team arms them with, are things that they need, they're desperate for in their day-to-day lives at work. So it's quite easy to bring them along, especially because most of them are tools that they might use in their personal life. So imagine, just as a use cases, that they use WhatsApp. I'm not saying WhatsApp should be used for NHS use, but if they're used to using that, it's a really practical platform. Is that they're going to naturally think, well, what's the equivalent? What else works really well for me? It's quite natural, in all honesty, is that as much as the team and I look out to what's going on in healthcare or in industry or with suppliers, we've got a constant stream of staff coming towards us or coming into the IT department and saying, I want to do X, or I've seen Y, how do we make it work? I think that's, I don't know if that's something specific to the public sector, but I think because we're, I don't want to say constrained by finance, but we are to an extent, resources less than ever, is that people they do that bit more, they do their own research and bring things to the table, and they understand their specialities, they understand their areas. There's no use me taking a stack of technology to ED and saying this all works great in theory. They need to tell me the needs, and then we can figure it out together, and that works really well.
You hit the nail on the head there. It's about the problems, isn't it? What challenges are we looking to overcome? What outcomes do we want to achieve? And then we mentioned in one of the previous sessions, and then working backwards from there, because there is no point in having technology, is there? For technology's sake, it's got to fix a problem. It's got to make something more efficient, and it's got to help.
I think that's one of maybe the country's biggest frustrations with the NHS, is that they can see all this amazing technology it's out in the world, and they don't understand how it doesn't instantly translate into healthcare. And it's because of all the complexity, it's because of all the people and the different roles and the different way they use these things. That's what makes it complex. I'd love to say that we could just go out and cherry pick all the best technologies in the world and we can just roll with it. But even if we could do that and money was no object, I don't think it'd work that way.
No, agreed. I mean, you said a lot of people come to you and say, they've done their own research. Possibly that could be limited. They're not experts, but they say, "Oh, this might be good for our area, the organisation." How do you take all of that? How do you make a decision on what type of technology you're going to introduce? Where I don't know, you think that's a great idea, and actually this could really, really work. What research do you guys do? How do you go about introducing that new piece of technology if you think the benefits or the outcomes are achieved?
I think that the way we test it first and foremost is we see what's going on elsewhere.
Yeah.
So I think that it probably isn't that common in the NHS, even though it should be. That there feels sometimes like there's competition between trusts, and there definitely shouldn't be. Is that I've got a really strong network of peers in this country, in the US as well of late, that we can bounce those ideas off. We can understand, have you tried X, have you tried Y? They can give us an idea. We're not reinventing the wheel then. And certainly the way that we like to work is we like to take something that we've already got or take something from a partner and give it a go. Small tests of change, see how we get on, see if it's of use, and then see, right, if it is, great, we can scale it up. If it's not, nothing's lost, we can try again. And I think a part of that, and it's again something we touched on in the previous episodes, is that partners are quite keen for us to try things, and not only it benefits us, but it benefits them as well. And I think that's like a big piece, in all honesty, that collaboration between industry, because in the absence of that, we can't just keep trying the same thing over and over again. It never works. But if we can try new technology, new processes with the staff live, then I don't see how we ever lose out, in all honesty.
No, absolutely, giving it a go. And it's really interesting what you said, and I completely concur with you with conversations I have regularly, is peer-to-peer. What are you doing in this space? How have you overcome the the Wi-Fi in hospital situation, and just having discussions with others who've maybe done a project recently is a real big benefit. The second point you mentioned there was partnerships and partners, and of course, we've been partner for quite a long time, a good number of years, Tom. And I think that's exactly it, isn't it? It's the ability potentially to work together and, come up with new innovations, but also think why they might be relevant to you. It's not about pushing a certain technology just because it's been developed. It's what's in it for me, right? And would you agree with that in terms of, how does it help me as an organisation?
100%. And I think that you guys particularly, you get it, is that not only it's a two-way partnership. There's been times in the past when we'll speak and you'll ask me, would this work in this scenario? And equally, I do the same to you guys. And I think that's the way that the partnership needs to work. I think if that doesn't happen, then I think that's when you tend to stagnate, and that's when you tend to have an absence of any strategy, because you can't continue, especially in healthcare, keep looking internally.
Yeah.
Because you're not going to develop, you're not going to change at the pace that we need to.
Yeah. I mean, going back to that point you made in relation to that a couple of minutes ago, we tend to find that when somebody comes to us, they might have had an idea of, some of the, have done their own research, and we're finding that more and more and more. It's less about selling anything. This is not, that's not where we are as an organisation anymore. It's more about consulting, saying we see that. Did you know X, Y, Z in a similar organisation are doing this? Have you guys thought about it? It's much more consultative.
I think that certainly I know peers and I know other people in healthcare and in procurement departments, finance, you name it, is that people are petrified of being sold to. So there's avoidance behaviour in speaking to suppliers and to engaging with them, because they think that if I speak to company X or company Y, I'm going to be sold something.
Yeah.
And we need to get away from that idea.
Yeah. And actually the way people buy things is changing, right? So a lot more research on the internet and things like that. Just going back to the partnership, obviously we've been partners for many, many years. Why is that? Is there something you could put your finger on as to why? What do you like about, the way that we work with you and that we partner with you, and hopefully listen as well?
I think that the way that I work specifically, and then Ian, or you'll know as well, my manager, is that the way that we've done business for the organisation over sort of 10, 15 years for me, and Ian beyond that, it's been a bit old school, and it's been about relationships.
Yeah.
For a long time, when we were sort of flirting with the idea of moving from ISDN to SIP initially, and obviously now we've got the mobile piece and other things that have followed, is that spoke with colleagues up and down the country and said, who have you got fixed with, who have you got mobile with? And the name Gamma kept coming up. So that was a natural place for us to start, in all honesty. I'm sure Robert Jones, your colleague, he'll remember it well, is that I think I gave him a ring one day and we were on the phone for a good couple of hours just talking through how it would work, how Gamma are as a partner, and how we could do business together. But then I don't think we did anything commercially after that for a good couple of years. But that didn't mean that the relationship ended. I think that, back to what I was saying, is because we like to work in that sort of more old-fashioned way. I don't think it's as common these days, is that people buy from people, and I think that's what we still see. Yeah. I think that because we'd sort of invested in that relationship and you guys had already, it meant that when it came time, when we were putting stuff out to tenders out and you were responding to them, is that you had a good understanding of us as an organisation. We had a great understanding of you guys as a supplier. That there's a great benefit there. It means that you are going to score well on quality, and Elvis evidently scored well on price, and that's how it began in all.
Two fundamental areas, aren't they? Yeah. I mean, that's the bit I was touching on, was the culture and fit, because we, from my side of things, it's exactly the same, Tom. It's the trust that I think we've built up as two organisations together. Is I'll happily come to you with your blessing and say, what do you think about this as an idea in this particular space? And what I really like is you'll be honest about it, and you'll say, actually, I don't think this will fit, or if you could tweak it, a little bit. Then it's just great having that level of.
I think that's why naturally we ended up doing the business on the mobile piece as well, course, because not something that we look after directly anymore. We passed it to IT because it's more about data and devices these days. But as soon as, we'd never had a conversation about mobile, even though you knew we had thousands of them. But the second it came up in conversation with colleagues that look after our trust, we haven't got a bad word to say about you, because we've had that great relationship already. So that then sets them up and thinks there's some confidence there. And back to what I was saying earlier, is that the quality's there and naturally the price is there. Or in that order, I'd like to make a point that for us is we always try and lean as heavily as we can on the quality of the submissions and the returns on tenders, because in this day and age, you can have a return and the price is fantastic, but the quality is not necessarily
Depends
there.
what you get as the balance,
That's
isn't
back
it?
to where,
Yeah.
well, then you've not got that great relationship, and it's not a real partnership. It is just a commercial relationship.
No, I think that's fantastic, and it is all about trust, isn't it? That's the thing. It's it goes back to that human-centered approach. You can do, when you look at a new solution to fix an outcome, reach an outcome, fix a problem, you can do all the research, but until you get to know somebody and know that they, you can talk to them openly, it's quite a positive area. Really good to hear, Tom, and thank you for your support with the podcast, the collaboration podcast series. Much appreciated. Fantastic to hear about you and what's going on in the organisation. I didn't realise it was that big, actually, close to between 20 and 30,000 depending, but much appreciated, and thank you very much for your time.
Thank you, mate.
So, cheers.